Connecticut. It's time to once again talk about COVID, put things into good perspective here in Connecticut. For that, we always turn to Dr. Syed Hussain from Trinity Health in New England. Doctor, good to see you again, sir.
Thank you for having me.
And it's good to have you on this morning where it could be a very big day, looking at the FDA possibly authorizing, at least for emergency use, COVID booster shots in the youngest age range. What are your thoughts about that? I've seen some people think, do kids even need a booster at this point?
Yeah, it's an important development. So if you look at the data that the FDA is crunching in right now as they make their decision, followed by the CDC, we hope by Thursday, the data shows there's a 6-fold increase in antibody protection levels following a booster shot in this age group. So it's an important tool in our arsenal. Now, one caveat here is the rate of vaccination in this age group has been pretty low. So we still have work to do. There's some hesitancy amongst parents. Also, this youngest age group does not really see as much severe disease as adults. So that adds into the complexity, the challenge that we have in terms of getting everybody vaccinated.
I know this isn't a clinical question, but at some point, just in terms of your personal opinion, does the primary reason for vaccination in these younger age groups become being able to stop them from spreading it a little more easily to the older family members who are more at risk?
Yes, that, and also to prevent severe disease. We've seen some cases in this age group, in the younger age group, with severe manifestations of COVID-19. We don't want our children to suffer long COVID and other manifestations. So it's important to protect them when we have tools.
Miss C be one of those multi-system inflammatory syndrome? Okay, so that's good. That drops it dramatically. Starting to see more masks come back now that cases are going up. Just curious what kind of utility there is. And given that with each variant it's getting more and more contagious, masks are having a tougher time sort of being able to stop it or at least provide really substantial protection. Where do we stand with masks?
So it's an important tool in our toolbox, all these public health measures, and we're entering a stage where people need to weigh their individual risk. If they're higher risk for developing severe COVID-19, it's important to stick to public health measures, especially when you have high community transmission like we see in the Northeast right now. Masking is an important tool in addition to distancing and also getting vaccinated. Yeah,
looking at that shift, like you said, to personal responsibility from public. That would, I guess, then make it make sense if you were the only person wearing a mask, say, in the supermarket. In 2020, I would guess, well, that's not really doing much. Everybody needs to do it. But you're saying it has more utility now because you're just worried more about protecting yourself?
That's right, absolutely.
Okay. Also moving on, the second booster, people starting to get out there. When's a good time frame for people to get that?
So right now, the second booster is authorized for individuals age 50 and above, as well as if you're 12 and above with a moderate to severe immunocompromised condition, then you're eligible to get the second booster. It's 4 months after the first booster shot.
4 months after the booster. Got it. One last quick thing. Are we still surprised? I mean, I know when we were first trying to draw analogs here, we'd use the flu. The flu tends to come during the winter when people are in. This is a respiratory virus like the flu. And yet here we are. The weather's getting warmer. Cases still rising up. To what degree is that surprising to you and to other research?
Really not that surprising. The current coronavirus that's leading to this pandemic is behaving like its cousins that cause the common cold. So we'll probably see this virus continue to evolve into a state, hopefully, where it causes milder infections and less of severe disease.
And I think next time we have you here, hopefully we can do this every week, want to talk a little bit more about that, look at what the future might hold given where we're seeing those trends go. But thank you for the knowledge again, Doctor. Good to see you again.